Namaskar. Welcome to Ahara Arogya Adhyatma, the light of Samskara. Today we have Dr. Hema D. And she has done her fellowship after her MD Pediatrics in perinatology, and that too from St. John's Hospital. And she has been working in Chinmaya Mission, and now she is working elsewhere. And she continues to take care of the small babies, very small babies. So let us find out what are the complications to be anticipated and how to treat them. And especially, Hema, welcome to our show. And the many a times the newborn babies they develop jaundice, and this is not the infective jaundice like the adults get, but still it is very scary when the baby becomes yellow. So tell us, what are the causes of this neonatal jaundice?
So we have two types. One is the pathological jaundice and the physiological. Pathological is which happens within like 24 to 48 hours, where the cause will be RH incompatibility or OA setup or the OB and other hemolytic causes. So that will be detected during the hospital stay, because they will be still in the hospital, mother and the baby. Next comes what the parents should be aware of is the jaundice which comes after 4th or 5th day. So that is your physiological jaundice. So it can happen due to the weight loss, excessive weight loss, dehydration, and there is liver is still immature to conjugate the bilirubin. Those are the commonest reasons for the physiological. So usually whenever it is detected at a lower range, like 18 to 25 range, we treat with the intensive phototherapy. It reduced.
But before we go for the phototherapy, how will the mother or the attenders realize that there is a jaundice?
Yes.
What are the features?
Yes, that's a very important question, madam. Thank you for asking that. So we advise the mother before the discharge, she has to take the baby to the nearby sunlight and look for the yellowish discoloration. Eyes will be yellow for all the babies, but hands and palm is very much important. If the baby is looking more yellow than the usual, than the previous day, she will be knowing the comparison. So she has to immediately go to the nearby pediatrician and get the jaundice tested.
Okay.
So based
you said the palm and the feet, but if the body also becomes yellow, what does it mean?
So actually the palm and the yellow becomes yellow only after the chest, abdomen. It progresses downwards. First is eyes, face, chest, abdomen, legs, and palm and soles.
And then palm. Okay.
So that's the last one too. So that's a like alarm sign for the parents.
And also, when the baby passes urine, in case they have put the pad or they have collected, that yellow coloration, can they not suspect jaundice?
So yellow can happen in both dehydration, whenever there's excessive, concentrated
concentrated
urine also, along with, yes, jaundice do has that yellowish thing. But in the babies little, they'll have this yellow color.
Yeah. So once it is there and they go to the doctor, next what?
So depending on the level of the serum bilirubin, we decide our treatment. The first line of treatment is definitely phototherapy, where we give it the phototherapy wavelength of about 420 to 480. That's exactly 450 nanometer wavelength, which reduces the jaundice level. Suppose if the parents have come late or lately recognized jaundice, where it is at a higher level, like 30 milligrams per deciliter. So that time we advise this exchange transfusion for the baby.
Now, before we go for the exchange transfusion, in the olden days, many decades ago, they used to put the baby in the sunlight, covering the eyes. Is it dangerous or should not do or should do? What is it?
So there are three things with that exposure to the sunlight. One is you have kept it open. There are chances of hypothermia, especially in the winter. It is challenging for us. And our sunlight has UV rays, other infrared rays, everything. They are harmful to the babies, which leads to the dehydration.
The skin,
So it leads to the dehydration. And that again, the third thing is with the dehydration, again the jaundice will increase. It leads to that enhanced enterohepatic cycle.
It's a vicious cycle.
So dehydration will again worsen the jaundice for the baby, along with hypothermia and other things. So That's this particular wavelength phototherapy is made for the babies.
Baby. Okay.
Yeah,
Okay.
yeah.
Now, after the phototherapy, you go for the blood transfusion.
Yes,
That means
yes.
the yellow colored, having high bilirubin, that blood is taken and
Yeah.
the fresh blood is
Fresh
given.
blood.
How do you
Yes,
do it?
yes.
How do you do it?
So this we first keep our the blood matching, like there should be no reaction, the blood ready. O negative whole blood is the preferred one, but it's very difficult in the practical scenario too. So we go for the mother's blood group, which
Blood.
is
Okay.
matching for the baby's blood. So we insert a center line through the umbilical vein. Suppose our cord is dry, if we are not able to assess, we put the arterial line also. And we put, so the old blood is removed and the new blood. It's not so easy as I'm telling. It has its own like monitoring everything. But in simple language, 80% blood is replaced with the double volume exchange transfusion. So that's enough for us.
So though we call total exchange, we are changing only 80% of the high bilirubin containing blood and then putting the new one. With this, you can prevent kernicterus. What is kernicterus? And please explain what is the danger.
So that's the complication of the jaundice which is left untreated. So nowadays we call bilirubin induced neurological dysfunction. So first it develops the bind, then it leads to the kernicterus. So as the blood-brain barrier is not developed in the babies, the free bilirubin, it will cross the blood-brain barrier and it will get deposited in the brain, especially in the basal ganglia. So once it gets like deposited, we can't reverse the neurological sequelae.
Because the baby's brain develops in the last 3 months and then after birth the first 3 months. So soon after birth, if the brain cells are damaged, and then the IQ and everything will so it is very tricky situation.
Yes. So that's why we are in the hurry to remove that bilirubin as fast. That's why we rush and do that exchange to prevent this damage.
And Dr. Janki, my granddaughter had kernicterus and she had done the exchange transfusion. Now she has joined the medical college now. And she said, I'm so very happy the baby's brain is so normal, she said, because and they test the ears and everything afterwards.
Yes.
To whether the damage is done.
Yes. So we do BERA testing to see the hearing loss component with high jaundice. So this is the complication if jaundice gets noticed late.
So one suggestion is keep a watch on the yellow coloration. And especially if the palm become yellow, immediately rush to the hospital. That's the thing. Now, what about the skin care? So many times we see the rashes and here and there. And what are the things that the do's and don'ts for the mothers?
So normally we see few rashes after the birth. The commonest one is erythema toxicum. These are the macules and the papules rashes which develop over the face, chest, abdomen, over the buttocks. Nothing to do. Just give a normal bath, normal moisturizer. So apply the moisture, pat dry the baby after the bath, apply the moisturizer so that it captures the moisturizer. Then overdressing and the heat, it will lead to the malaria, the small vesicles over the forehead and the neck.
Because
so
of
more
the sweating.
The sweat blockage of the sweat glands, so malaria. So stop overdressing the baby. Like whatever is required, that much clothing enough, you can reduce the malaria. And neonatal acne. This is developed because of the maternal hormone transfer from the breast milk. So this acne, it will reduce itself. What happens is, what happens is these after going home, they put rice flour, all the scrubbing happens for the baby. It leads to some more irritation and vigorous oil massage, everything that leads to more skin irritation, more rashes. So it's not required so much vigorous massage or application of all this rice flour, everything for the baby. So just a simple oil massage.
What oil do you suggest for the?
We use coconut oil. Even for the smallest preterm, coconut oil is best. We don't recommend any massage oil like by the companies. It's not required. A simple coconut oil helps in capturing the moisture and a good weight gain. That is more than enough.
And also the coconut oil is antifungal and antibacterial also. And the mosquitoes also don't bite. when you apply the coconut oil. So it has got multiple benefits. And also the nappy rashes also will be there, no? Sometimes if the mothers are not cleaning the,
So nappy rashes are mainly because of the wipes what we use. It rubs on the skin. Just a cotton cloth and water is enough to clean the buttocks area. And a simple nappy cream, if it is extensive, or leave it dry like that, it reduces the nappy rashes.
Okay.
And
So
don't
if
try.
they don't have the thing, at least the cotton can be dipped in water and clean
Yeah.
it.
Pad
So that
dry,
can be
yes.
done by pad
Yes,
dry
yes.
thing. Okay.
Yes.
Okay.
So,
And
and
what about the powder? Many people, I have seen the baby means putting the powder and then putting all the black things here, there, and everything, and they decorate the baby like a doll, So, does the powder do good or bad to the baby?
So powder, it causes its own problems for the baby. So inhalation of this powder, it will cause the respiratory issues and also dryness of the skin. So we don't recommend talcum powder, especially they're all fascinated with a good fragrance talcum powder. And good fragrance one, we don't even recommend even for the moisturizers or for the soaps.
Okay.
So it's not needed.
Anyway, baby doesn't make out the fragrance, because it's a newborn baby. The fragrance is for you and not the baby.
So we don't recommend the fragrance.
And that can cause the allergy to the baby also, no? The powder itself, and so the talcum powder is not required. So now for a mother who has just first baby she has got, now finally you tell me what to do, what not to do. The breastfeeding is a must. It's a must. The oil bath is okay, but massage is not okay.
No vigorous massage.
Vigorous massage
little
is
oil.
not okay. Oil, applying coconut oil is okay, but not the massage. Okay. Talcum powder, not recommended. Don't give it.
No.
And don't cover the baby with so much of clothes so that it sweats and gets the rashes. So that is another thing. And one more thing is, don't allow the head to leave exposed to the thing. Otherwise, it will become cold. So cover the head properly, but not put the heavy clothing. So any other suggestion you would like to give, and keep the baby as much as possible to yourself nearby, so that it has the feeling of mother's warmth and the affection also. So anything else?
See, all the mothers, when the God has given you the baby, definitely you'll get the breast milk for sufficient enough. So you should be confident. The confidence you are, the better oxytocin and prolactin secretions for you, and the better lactation.
So
don't lose your confidence and keep breastfeeding.
Thank you so much, Hema. It's so beautifully you explained to our viewers. Thank you.
Thank you so much, ma'am. Thank you.
Thank you.